Welcome to Cardiology Course 101, Wolff Parkinson White Syndrome. In this course, we will delve into the intricacies of Wolff Parkinson White, WPW, syndrome, a congenital cardiac condition characterized by the presence of an additional electrical pathway in the heart. Throughout this comprehensive script, we will explore the physiology, clinical manifestations, diagnosis, and management of WPW syndrome. Summarized briefly. Wolff Parkinson White syndrome is a cardiac condition caused by an extra electrical pathway. It can lead to various arrhythmias. Diagnosis involves clinical evaluation and tests. Treatment depends on symptoms and risks, ranging from medications to procedures like catheter ablation or surgery. The crucial element in WPW syndrome is the presence of the abnormal accessory pathway, anatomically known as the bundle of Kent. Unlike the regular electrical conduction system, the bundle of Kent connects the atria and ventricles directly, circumventing the normal atrioventricular node. Variations in the location, number, and size of the accessory pathways contribute to the diverse clinical presentations observed in WPW syndrome. Understanding the intricacies of the bundle of Kent aids not only in diagnosing this syndrome accurately but also plays a vital role in planning therapeutic interventions, especially during catheter ablation procedures. Wolff Parkinson White, WPW, syndrome is associated with three main arrhythmias: AVRT, antidromic AVRT, and atrial fibrillation. These arrhythmias have distinct electrophysiological mechanisms, and understanding them is important for diagnosis and treatment. Electrocardiography plays a pivotal role in the diagnosis of WPW syndrome. The characteristic ECG pattern of WPW reveals a short PR interval, widened QRS complex, known as the delta wave, and a notch called the delta wave notch on the upstroke of the QRS complex. However, it is essential to differentiate WPW from other ECG patterns that may mimic its features. Differential diagnoses include other pre-excitation syndromes like Lown-Ganon-Levine syndrome and specific abnormalities related to the atrioventricular node. Accurate recognition of these ECG features and their differential diagnoses ensures appropriate management decisions. In the video on Wolff Parkinson White, WPW, syndrome, we discuss the importance of risk stratification and prognosis assessment. Different tools are utilized to evaluate the likelihood of complications based on symptoms, pre-excitation pattern, and specific ECG abnormalities. This information guides management decisions for patients, including treatment options. Although the characteristic electrocardiographic findings make the diagnosis of WPW relatively straightforward, there are other conditions that can mimic WPW-like patterns on the ECG. These differential diagnoses include various congenital heart defects, structural heart diseases, and electrolyte imbalances. It is crucial for healthcare providers to differentiate between these conditions and true WPW syndrome to initiate appropriate treatments and avoid unnecessary interventions. In order to diagnose and assess the severity of Wolff Parkinson White, WPW, syndrome, doctors may recommend Holter monitoring, exercise stress testing, and electrophysiological studies. These tests provide important information about hidden arrhythmias, exercise-induced symptoms, and the specific location and characteristics of the accessory pathway. Understanding the results is essential for planning treatment. The management of symptomatic and asymptomatic patients with Wolff Parkinson White, WPW, syndrome involves considering medical therapy, catheter ablation, and surgical interventions. Symptomatic patients may require immediate intervention to alleviate symptoms and prevent life-threatening arrhythmias. The long-term management often involves catheter ablation, while surgical interventions may be necessary in specific cases. Decisions regarding intervention choice are made based on a thorough assessment of risks, benefits, patient preferences, and healthcare provider expertise. Pregnancy has unique implications for women with WPW syndrome. The physiological changes during gestation, including increased heart rate and volume, can worsen the symptoms of WPW and increase the risk of arrhythmias. Management strategies during pregnancy should focus on balancing the well-being of both the mother and the fetus. Individualized plans may involve close monitoring, adjustment of pre-existing medications, and cautious consideration of interventional procedures, keeping in mind the potential risks and benefits to both the mother and the developing fetus. WPW syndrome can present differently in pediatric patients, which warrants specific considerations in diagnosis and management. Pediatric diagnostic approaches may incorporate non-invasive techniques like exercise stress testing or pharmacological stress testing due to the rarely observed symptoms at rest. Risk stratification tools, tailored for pediatric populations, guide physicians in determining the need for therapeutic interventions. Age-related management considerations address the potential for spontaneous resolution or progression of the disease, identifying the optimal timing for invasive procedures like catheter ablation. WPW syndrome increases the risk of sudden cardiac death due to dangerous irregular heart rhythms. Factors like young age, fainting history, and abnormal ECG patterns indicate higher risk. Risk scores help identify at-risk individuals. Catheter ablation can reduce risk by fixing the abnormal pathway. The field of WPW management is continually evolving, with ongoing research contributing to novel therapeutic approaches and risk stratification algorithms. Advancements in catheter ablation techniques, incorporating three-dimensional mapping systems, have improved the accuracy and success rates of the procedure. Paired with emerging pharmacotherapy options that target specific ion channels involved in arrhythmogenesis, these advancements show promise in achieving better patient outcomes. Furthermore, recent developments in risk stratification algorithms increase the precision of identifying individuals at highest risk for adverse events, facilitating targeted management strategies. In conclusion, Wolff Parkinson White, WPW, syndrome is a complex cardiac condition that can have serious consequences. This course has covered various aspects of WPW syndrome, including its anatomy, physiology, arrhythmias, diagnostic tests, management strategies, and special considerations. By understanding this condition, we can provide better care and contribute to advancements in cardiology. Stay tuned for more updates in the management of WPW syndrome. Thank you for your dedication and best wishes in your medical careers.